Begin.
Start.
Hello, I am
Hello.
Dr. Yusuf. I am Dr. Yusuf, one of the doctors here in the emergency department. Are you Mrs. Maria?
Yes, Dr. Maria White.
Okay, Mrs. Maria, could you confirm your age, please?
It's 56.
Mrs. Maria, I have known that you come here because you have pain in the right eye. Is that right?
Yes, doctor. Yeah.
Okay, could you tell me what happened? What is the cause of that?
I don't know, doctor. I have this pain in my right eye, and it's getting worse. I feel like my eye is going to burst. I don't know what's going on, doctor.
Okay, it must be difficult for you.
Yeah.
For how long do you have this pain, Maria?
It started 4 hours ago, doctor.
Sorry, 2 hours ago?
4 hours ago. Unmute yourself. Unmute yourself. Yeah.
4 hours ago. Okay, Maria. And have you noticed anything making it better?
No, doctor.
Anything making it worse?
Yes, the light is bothering me a lot, doctor.
Okay, so difficult to look at light. And when you
Yeah.
look at light, do you see like halos around the light or something like that?
Yes, doctor.
Okay. And so Maria, this occur in the right eye. What about the left eye? Is the same for
No,
you?
the left eye is okay.
It's okay. Is it getting worse, Maria?
Yes, it is.
Okay. And is there any vomiting?
I'm feeling sick.
Feeling sick. Is there any headache, Maria?
Yes, I feel some headache around my eye here.
Okay. And what about redness? Are you red? Your eye is red?
Yeah, my eye is red. Yeah.
Okay. And have you sustained any trauma to your eye, Maria?
No, doctor.
No. Okay. Is there any discharge from your eye?
No.
No. So Maria, what do you think is the cause? Maybe do you have any idea?
I don't know, doctor. I don't know. No.
Okay. Have you taken any medication for this?
No, I didn't take. I didn't
Okay.
take anything.
So Maria, I just want to know, are you taking any regular medications before this condition?
You mean a medication usually I'm taking?
Yes.
Yes, I'm taking amitriptyline for depression.
For depression. So for how long do you have depression, Maria?
For a long time now, doctor. Maybe 3 years, something like that.
Okay. And do you have any medical problems apart from depression?
High blood pressure.
High blood pressure. Are you taking any regular medications for this?
Yes, amlodipine.
Amlodipine. Okay. So Maria, who lives with you?
I'm living with my family, my husband and my children.
And anyone coming with you now?
I came with a taxi.
With taxi. So what do you do for a living?
I'm a housewife.
Do you drive, Maria?
No, doctor, I'm not driving.
Not driving. Okay. So thanks so much for answering my questions, Maria. Now I would like to examine you. I will take your observations. I will examine your blood pressure, temperature, pulse, and also I will examine your eye specifically. I will see the visual acuity and visual field, and also after that we need to measure the pressure inside your eye. Would that be okay with you?
Yes, doctor.
Okay. Okay. So Maria, and what about the pressure inside the eye?
The pressure is increased.
Okay, so pressure is increased. So Maria, also thanks so much for letting me examine you. From what you told me and the examination, I can see that you have a condition called acute angle glaucoma. Have you heard about that before?
No, doctor.
Okay, this is a condition causing severe pain in the eye due to increase in pressure, due to increase the pressure inside the eye. It may be triggered by the medications that you are taking for depression, which is amitriptyline. So unfortunately, to tell you that it is a very serious condition, so we need to treat it as early as possible. Are you following me?
Yes, doctor. Okay.
Okay. So let's say what we are going to do for you now. You need to go to the hospital right now. Is that okay with you?
Yes, yes, doctor. It's okay. Yeah.
Okay. So you told me that you came here by taxi. So is there anyone can take you to the hospital? Would you be are you able to call any one of your friends, family to take you to the hospital right now?
Okay, I will. I will, doctor.
Is that okay with you?
Yes.
Okay. In the hospital, you will start the, the specialist of ophthalmology will see you and reassess you again and measure and monitor the pressure inside your eye, and will start to give you some medications, eye drops,
2 minutes remaining.
acetazolamide to decrease the pressure inside your eye. And then they will decide according to the pressure what is the treatment for you. It may be some medications or it may be surgery. The surgery for this condition, it by doing some small cuts in the periphery of the eye to help decrease the pressure in your eye. Is that clear?
Yes, it is clear, doctor. Okay, it's a lot to take in now. Right. So,
So I'm so sorry for giving you lots of information. I can repeat everything if you want.
okay, so I'm going to go to the hospital right
Yes,
now.
yes.
Okay. Will I lose my vision, doctor?
It is a serious condition, but we try to give you medication as early as possible. So if you go to the hospital right now, we try to assess you and give you medication and to stop any progression of your condition. It's very early to say that now.
Okay. Okay, doctor. All
Before
right.
proceeding further, do you have any concern?
No, no, doctor.
Okay, let's proceed. It's advisable to not to stay in any dark room, Maria, or not to wear any dark glasses. I know that looking at the light is very difficult, but staying in dark room may increase the symptoms and increase this condition, which is glaucoma. And also avoid driving. You told me that you are not driving. That's good. Okay, so try to go to the hospital with anyone, not to go by yourself. Is that clear?
Yes, it's clear, doctor. Okay.
Okay, okay. After after going to the hospital and you will have surgery, you will be followed up by the GP. He will give you some
Move
instructions.
on to the next station.
Time's up. All right. Okay. Thank you, Dr. Amani. Let me just go out from this. Hopefully
I feel that I am not confident.
Why? Why you are saying that?
Okay, thank you.
Stop the... Okay. Let me share it again. It is not combined station, Dr. Hala. We are doing history-based cases. Okay. You might have a combined case in the exam. This is what I've mentioned and explained in the last session. You might have eye case, a normal eye case, a kind of theoretical eye case. You might have an examination case. Okay. All right. Can you see my screen?
Yes.
Okay. So how do you feel about your performance before I talk about anything?
I feel that I'm speaking very fast and I missed eyes. I didn't ask about the concern, didn't ask about expectation and information of
You
the
did
patient.
ask about the concerns in the management.
I
You did
think yes, in the last, yes, in the last.
you did ask. It's okay. As long as you ask about the concern, it's
Okay.
okay.
Should I ask
Begin.
more? I didn't ask about glasses and contact lens to exclude keratitis. And
Okay.
okay, my differential diagnosis was very little. I am not sure. Okay, but I was trying to be early, finish early as possible to save time for examination and the management. I don't know if it is good or right or wrong.
Okay.
Just,
All right.
just thank you.
I will answer this question. Is it good or not? I will answer it in a
Okay.
short time. Okay, anything else you want to add?
No, thank you.
All right, no worries. Okay. So I'm going to comment on 4 aspects. What are they? The first one is your body language, okay? The second one is the interpersonal skill. The third one, the data gathering. Let's see this one. Can you see this picture?
Yes.
This slide? Okay. The data gathering, the management skills, and before that, I will comment on the body language and the interpersonal skills. Okay?
Okay.
Got me? So let's take it one by one. Okay. So firstly, in terms of your body language, your body language is okay. You have a good eye contact. You were not looking very anxious, and this is a good thing. Maybe you were feeling that you were anxious inside yourself, but it didn't appear to me. You were talking in a good pace, and you were not looking very anxious. Okay. This is in terms of your body language. In terms of the interpersonal skills, when I told you I have a pain in my eye, you can tell me, are you comfortable to talk or not? Really sorry to hear that you are in pain, and comment on that, because it's severe pain. You didn't ask me how bad is the pain. Okay, is it from scale 1 to 10 or 0 to 10? So it's better to ask, okay, and then you can ask me, are you comfortable to talk or not? Okay,
Yeah,
this is
I
the
forgot
first thing.
totally. I forgot this course. I don't know.
Any pain, please ask, how bad is the pain? How bad is the pain? From 0 to 10, how can you grade your pain? Okay, why is that? Why it is important? Do you know why it is important?
Because the management depends on the pain. If severe pain, they will give
If
you
it's severe, you will
painkiller.
give strong painkiller. If it's mild, you can start with paracetamol. Okay?
Yeah.
All right. So this is the first thing. The second thing is in the management, the interpersonal skills in the management. You were very rushing to give me the management. Okay? As I mentioned in the, maybe you didn't attend the last session of the eye cases, but you don't need to say every single information to the patient. All what you need to say is the diagnosis, the provisional diagnosis, explanation of the provisional diagnosis and checking the understanding of the patient, addressing the patient concern. If the patient has any concern, address it. All right. Then you tell what is the next step. Is that patient going to be treated in the hospital or at home? What is the next step to say to this patient? Okay. And then check if there is any concern again, or if he does understand the information. And then you tell him the future treatment, but in a systematic way, in a good pace. Okay? So you will tell her from the examination, I'm suspecting that you have something called acute angle closure glaucoma. Have you heard about this before? No. It's a kind of increased, acute or sudden increased pressure in the eye. Okay? It could be serious. It could be serious. but don't worry. The good thing, so tell her that it could be serious, but reassure her. Okay, don't scare the patient. All right, unfortunately it could be serious, but the good thing that you came now. We are going to treat you, and we are going to do our best to save your vision. Okay? Would you like to hear our plan for management? Okay? Yes, doctor, please. All right. So, the best thing to do in your case now is going to, but here the patient is already in the hospital. Okay? Can you see this? In the emergency department. Okay? This is not a major mistake. It's not a major mistake. It is a mistake, but this is not a a failing mistake. All right? But I'm telling you, try to make sure to find where you are and what is the next step based on where you are. All right? So you are going to tell her, we are going to admit you in the hospital to treat this condition. Would you like to know what will happen here? Yes. So we are going to give you painkiller to ease this pain. And then we will involve the eye specialist. They will come to examine and assess you again. And they will treat you accordingly. They might give you a treatment to reduce this pressure in your eye. Okay? Is that clear, Mrs. Blah, blah, blah? Yes. Okay. I would like now to give you some advice, if you would like. Then you tell me the advices that you wanted to give to me about the light and the driving and these things. All right. So always make your management organized. Okay. You don't need to talk about the surgery. You don't need to explain the surgery to the patient. As long as the patient is not concerned about this, and this is not the first step in the management, or it is not the the crucial thing in the management, or the major thing in the management, you don't need to talk about it. Got it, Dr. Amani?
Yes, very helpful.
Okay.
Yes.
So don't rush to say everything in the management. The management should include the provisional diagnosis, the prognosis, addressing the patient concern, the next step in the management, and then the future management. If you want to give leaflets to the patient, if you want to follow up the patient, if you want to give him some advice about his lifestyle or anything for his safety at home. All right. And these are optional if you have time. Got me?
Yes, thank you.
All right. So this is in terms of the interpersonal skills during the management. You scared me, and you were very rushing to tell me all of the information that you know.
Yeah, that's
and
right.
This is not right.
Yes.
Okay. So this is in terms of the interpersonal skills. Again, comment on the eye pain. Are you comfortable or not? And then you ask about psychosocial, and this is you asked me about the psychosocial. After that, in the management, please don't rush to say everything. Don't scare the patient, even if it's a serious condition. Even if it is a serious condition, don't scare the patient. Tell him the good thing that you came in here. We are going to do our best to help you. You are in safe hands. All right?
Okay, thank you.
Okay, so I would say 2 in the interpersonal skills. Okay? In data gathering, You explored, the exploration was halfish. You told me since when? How did it start? Does it go anywhere else? Anything that makes it worse, anything that makes it better? You didn't ask me how bad is the pain. Not halfish, to be honest. You missed the 1 or 2 questions in the exploration. And you didn't ask me about if this pain makes me dizzy or sweaty. If the pain is 10 or 9 out of 10, sometimes it's associated with hemodynamic instability. So you ask him, does that pain make you sweaty or dizzy? All right. So these are the 2 questions that you missed in the exploration. All right. Then in anything else, you asked me about halos, nausea, vomiting, which is really good thing. You asked me about discharge and headache, which is a really good thing as well. You missed asking me about vision affection. Vision affection, please. Any pain in the eye, any symptom in the eye, please ask about the vision affection. All right. You included it in the examination, to be honest. So I'm not going to to deduct a large mark from this, but for your knowledge, it's very important to ask about vision affection in any eye symptom. All right. Vision affection. Do you wear lenses or glasses? And neurological symptoms. Okay, if you allow me to share this for you, just a second. Hopefully I find it quickly. It's in here. Yeah. Where is it? Yeah. Can you see this, darling? Can you see this picture?
Yes.
Pain in the eye. These are the other symptoms that you need to ask. Only those. Any vision affection, redness in the eye, discharge, itching. You don't need to ask about itching here because the pain is severe. Do you wear glasses or lenses? Any headache, facial weakness or arm weakness, neurological symptoms in acute eye symptom. All right. Okay. So these are the things that you need to ask in the differentials. You missed vision affection. You missed asking about the neurological symptom. Right? Did you ask me, did that happen before? No.
No.
Did that happen before? Any medical conditions, any medications? Here, I would like to comment on a specific thing. You explored the symptom, and then you asked about the other symptoms of the eye. Then you told me, are you taking any medication before that? Before this eye pain? Well, this question is not good in this case because it will show that you are scripted. Okay? You can ask the patient, do you have any medical conditions? Do you take any medications for this medical condition?
Yes, I think it's logic to ask about the medical condition first.
Yeah. So sometimes the glaucoma, acute angle closure glaucoma, comes because the patient was just sitting in a dark room and watching the TV. So you can ask me, any specific thing happened before this pain. Okay. These are the things that I would comment on them, or I could comment on them in your data gathering. Otherwise, you asked me about the psychosocial, the driving, you asked me about concern. It's okay to ask it in the management or in the history taking. Both of them are right, as long as you ask about the concern. It should not be a problem. Okay. You ask it for the examination, observations,
So
and visual.
Doctor, can I ask a question, please? In the GB clinic, if this case in the GB clinic, can we offer the patient us measuring intraocular pressure or not? Because
In
pressure can in GB clinic, the intraocular pressure can be measured in the GB clinic or not?
No, in the GP, no. The patient is already in the hospital.
Yes, I'm asking another case in the GB clinic.
In the GP, no.
No. Okay.
Okay, in the GP, no. All right. So these are the things that you missed in your history or in the data gathering in general. Okay. Don't miss asking about the how bad is the pain, vision affection in any eye symptom, please, and neurological symptoms. And we have talked about how to ask about the medications if you would like to ask about medications. Okay. So in the data gathering, I would give you 3. You missed the neurological symptoms. You asked about the vision affection, the visual acuity in the examination, so I'm not going to deduct this mark from you. Neurological symptoms, and you know, you were a bit scripted, but you know, we talked about how to ask about the medications. In the management, I would say 2 in the management. Why? You were very rushing to say everything, and this is not right. You scared me. You told me irrelevant, you know, not irrelevant, but not very important information in the management for this case. Okay, all what you need to say that we are going to admit you, we will treat this pain, we'll give you painkiller to ease this pain, and to decrease also medication and eye drop to decrease the pressure until the eye specialist comes and examine you, assess you again, and they will treat you accordingly. Okay. Would you like to know the future plan, or would you like to know what you can do for yourself after treating you? Yes, doctor. Okay. It's very important to avoid the dark room. What else? Also, we will review the medication, to give you another another alternative. Yeah, and safety, the driving. If it's, you know, you can tell him, you can tell the DVLA after that. All right. So these are the things that you missed and how to avoid them in the exam. Okay. I would give you a tick in the report, in the management, and yeah, these are the things that can give you tick in. All right. Thank you so much. So inshallah, you will avoid these things in the mistakes in your exam. You will do very well in the exam, and inshallah, we hear very, very good news about your results soon. All right.
Yeah, I'm saying that, doctor, because unfortunately in my practice, I do better than what I did. Okay, because I do everything. I differential diagnosis and analysis for Socrates very well, but I am not sure why I did it. Why I forget today to ask about the score of the pain, ask about neurological symptoms, excluded strokes, for example. Unfortunately, I am not. I was very scared that the time is not enough, so I'm trying to finish everything.
It's okay. It's okay. I told you, whatever you do in the case, don't take it as if you are not going to do well in the exam. I know doing
Yeah,
the station in front of people is stressful, and also doing the station in front of someone who is going to assess you or give you an assessment based on the GMC, criteria. This is a stressful
okay.
situation as well. So this
Yeah,
doesn't
it's okay.
reflect.
It's very useful. Thank you. Thanks so much. It's very useful for me because it is open. I thank you.
Okay, thank you, darling. Yeah, let's do the next station. Let's say John Hancock, 35 years. 35.
Begin.
Good morning. My name is Sayra Ramadan. My GMC number is 12345. Hello.
Hello.
Hi, I'm Sayran, one of the junior doctor in GP clinic. Are you John Hancock?
Yes, doctor.
What do you want me to call you?
John is fine.
Nice to meet you, John.
Thank you.
Can I just confirm your age?
It's 35, doctor.
All right, John, I understand that you are here. You have some concern, so I'm here to talk to you and address your concern. How can I
Yeah.
help?
Actually, doctor, I have pain in the right eye, doctor.
Pain in the right eye. All right. And what about the left eye?
No, I don't have pain in the left arm.
Okay. Can you tell me more about the pain, John?
What do you want to know exactly, doctor?
Okay, since when you have this pain?
It started maybe 2 days ago.
Okay, till now you have the pain?
Yes.
Can you score it for me from 1 to 10? 1 is the lowest, 10 is the highest.
It's 5, doctor.
Okay, I'm so sorry about that. I'll try my best to be quick and treat you. All right, does the pain go to anywhere else?
No.
Okay, is it getting worse?
Yes.
Anything make it worse? Anything make it better?
Yeah. When I move my eyes, it's getting worse.
Okay, and did you try anything to make it better, like taking any medication, painkillers?
I did take paracetamol, but it didn't help at all.
Okay, can you describe the pain for me, the nature of the pain?
I'm not sure, doctor.
No worries. Okay. So has this happened before?
Yeah, I had this pain before, maybe 6 months ago.
And what did you
Yeah.
do? Yeah, sorry. Okay, what did you do at that time?
I didn't do anything. It went on its own.
Okay. So before the pain, is there any specific thing happen?
No, nothing specific happened, doctor.
Okay. Do you have anything else beside the pain?
Yeah, my vision is blurry.
Oh, okay. Can you describe it? What do you see exactly?
I feel I'm feeling like I can't see things properly, and also the colors are different to me.
Oh, okay. And what else beside the vision?
And nothing.
Okay. Is there any redness of the eye?
No.
Any headache?
No.
Okay. Is there any discharge coming from the eye?
No.
Do you see any colors around the light?
No.
Okay. All right. Good. Do you wear any glasses or contact lens?
No.
Okay. Is there any history of trauma to the eye?
No.
All right. So any weakness in any part of your body, arms?
No, doctor.
Okay, John, do you have any difficulty breathing or difficulty swallowing?
No.
Good, good, good. Thank you. Do you have any medical condition I should be aware of?
No, doctor.
Okay. Are you taking any medication?
No, I don't take any medications.
Okay, good. Are you allergic to anything, John?
No.
So is there any family history of eye problem?
Well, my mother
Mhm.
had this eye problem, and she was diagnosed with multiple sclerosis.
Oh, I'm sorry about that. How is she right now?
She's okay. She's taking her medications, and yeah.
That's good. That's good. Okay, so John, do you have any idea what might be the cause?
Well, I'm thinking of multiple sclerosis.
Well, this is one of the valid cause, but I will assess you first, then we will discuss about it. And
Okay.
are you worried about anything?
I'm worried about my vision, doctor.
Yeah, okay. I can see that you are worried. I'll try my best to help you with that. One more, I just want to confirm, do you drive?
No, I don't drive, doctor.
Okay. So, John, I need to assess you. I will examine you, check your basic observation like blood pressure, pulse rate, temperature, respiratory rate. I will examine your eye, looking outside the eye, checking your visual acuity, visual field. I will examine the back of the eye by the help of fundoscopy. And so after that, yeah. So I will just check my notes if you don't mind. Okay, John, so you told me some information and I examined you. So according to this, it seems that you have a condition called optic neuritis. Have you heard about it?
No, doctor, what is that?
It's inflammation or demyelination of the optic nerve, the nerve that supplies the eyeball, so it become degenerate or demyelinated. Well, there is many causes behind this, but in your case, it seems that you have also could have multiple sclerosis like your mother. But
2
we
minutes
need to
remaining.
confirm that, John. All right, we need to do some further investigation to confirm that. Are you following me?
Yes, yes. Okay, so it's an inflammation of the nerve that's supplying the eye. Is
Yes.
that right?
Yes, yes.
Okay.
But don't worry, it is like this, it's treatable, it's manageable, whether it's like no 100% cure and you could have recurrent attack, but there are some medication um, to prevent this from happening again. All right?
Okay.
So do you want me to tell you what we can do for you?
Yes, please, doctor. But before that, tell me first. Yeah.
All right. So I will tell you what I can do for you and what you can do for yourself. And I will also talk about some alarming symptoms to pay attention to it. We might give you after that some leaflet to read more about this problem. So regarding
Okay.
what I can do for you, I need to refer you immediately to the hospital, emergency eye hospital. So do you have any problem with that?
Yes, doctor. I have a work in an hour. I have a meeting. So can I go to my meeting first and then go to the hospital?
Well, John, this kind of condition need immediate treatment to prevent vision problem or vision affection. What about if you like postpone your meeting or talk to your supervisor, maybe this postponed it after you take the treatment?
Okay, I will see that, doctor.
Okay, that's good. Is there anyone can take you to the hospital?
Yeah, I can arrange for that. Yeah.
Yeah, that's good. If there is no one can take you, I
Move
can
on
arrange
to the
the
next station.
Time is up. All right. Okay. Thank you, Dr. Sayran. All right. So how do you feel?
This is my issue. I never complete my management. Never, never, ever. Never.
Okay.
Yeah.
It's okay. It's okay if you don't complete your management, but you do the most important things during the 8 minutes. It should not be a problem.
Okay.
It should not be a problem. Okay? If you do every important thing during the 8 minutes and you're still talking, it should not be a problem. Okay?
Yeah.
It will be a problem if you still talking, but you didn't spend the right time and do the important things during the 8 minutes.
So what do you think? Did I do or not?
You did. You did. You did. You just missed giving me corticosteroids.
I thought, like from my knowledge, I
No,
will
no.
take you immediately to the
They
hospital.
will.
Will give you, yeah. So I told you, do you want me to tell you what they can do? So they're in help.
Okay, this is what the only thing that you would talk about. But in general, you didn't miss, you know, a major
Begin.
important thing. Okay? Just a second, maybe. All right. Anything else before I talk?
Yeah, regarding the finding that you gave it to me, I should explain it to the patient or not, or just tell from my examination I found you have this.
Well, it depends on what you prefer. If you want to explain to the patient, it's okay. You have time and you want to explain, it's totally fine. If
I
you
told
don't,
you, I never have time. I
if you,
did.
yeah, if you don't have time and you feel that you are going to struggle when you are explaining these complex things to the patient, don't do that. Okay, so based on what you usually do, as long as you say the provisional diagnosis in the right way, you give the right management, you have the, a good interpersonal skills during the, proper interpersonal skills during the station, it should not be a problem if you don't explain the examination part to the patient. Okay. All right. Okay, so let's talk about the assessment. Your body language. Well, your body language is okay. You have a good eye contact. You have a good facial, body expressions. Okay, but try to avoid this smile while you are giving the diagnosis. Okay, especially if the patient is worried. All right.
Yeah.
You can smile when it's a kind of chronic problem. The patient is not worried. It's a usual conversation between you and the patient. Okay, then you can have this smile when you are giving the diagnosis. Otherwise, when you you give an emergency situation to the patient, avoid this small smile. This is the only thing that I would say on your body language. Okay. In terms of the interpersonal skills, no major problem, which is a good thing. I didn't find any major problem in your interpersonal skills, to be honest. You asked me about my concern, you addressed my concern. You told me that you are going to help me and you will be quick once I told you that I have pain. So, nothing which is major. I would love if you just said to me when I told you, can I postpone going to the hospital and go to or do the meeting for my job, for my work. You can comment by telling me, well, I know that it could be, or your work is important to you, and I appreciate that your work is important to you, but your eye is more important.
Yeah.
Okay, so
Okay.
I would love if you just said that to me. Okay,
Oh, that's okay. Fine.
all right. Yeah, so interpersonal skills, I would say 3. Data gathering, you didn't miss a kind of major thing, which is a really good thing. You explored, you asked about anything else, medical conditions, medications, family history, everything, okay? So 3, the data gathering. The management, in the management, the management parts are giving the diagnosis, prognosis, and telling the patient the management plan, right?
Mhm.
In the bit of giving me the diagnosis, you could have done it better.
Okay.
All right. You told me it is an inflammation of the nerve
Yeah.
of the eye due to demyelination. The patient doesn't know what is demyelination.
Yeah. Yeah. Okay.
So
At the beginning, I said inflammation. Then I say demyelination.
inflammation.
Oh,
And
yeah.
that's, avoid medical jargons, okay?
Mhm.
He might ask you, doctor, can you tell me what is demyelination? Then you will waste your time,
Yeah.
okay? So play it smartly, okay? So
Sure.
it's an inflammation of the nerve which is supplying your eye. Most probably the cause is
Multiple.
multiple sclerosis, but we can't say it is the exact cause before we do the further investigations. Okay?
Mhm.
You've said the words, but the way you gave me the diagnosis, it could be better than that.
Okay.
Okay? So try to practice on how to give the provisional diagnosis of optic neuritis to the patient. All right. This is in terms of the diagnosis. In the prognosis, you told me.
It's recover, like fully recover,
Yeah.
but it's recurrent.
Yes, you've done it. Okay. In the management, you told me that you are going to send me to the hospital and they will treat me. I would love if you just tell me that they are going to give you corticosteroids because this is the cornerstone treating that. And then the further treatment. So this is the only comment, the provisional diagnosis. Okay. And yeah, and when I told you, can I postpone going to the hospital? Just comment, just tell me I appreciate that you want to do your work and it's important to you, but it's better or it's more important to go to the hospital right now. Okay. 3 in the month. I could give you 2 because of the way that you give me the provisional diagnosis. So just to encourage you to work on the provisional diagnosis. But yeah, nice conversation, like in real life, like the chance and she, yeah. Dr. Sairan is one of my my candidates in the course. This is the first time to do a station with her, to be honest.
I bother you a lot. Thanks, yeah, I know. I'm really sorry about that, but I have no one else to ask.
This is the first time to do a station with you. I'm happy with your performance, to be honest.
Thank
I'm
you.
happy
Thank
with
you
your
so much.
performance.
Thank you.
Okay. No, I'm just answering doctors. They said great and nice conversation, so I'm happy with your conversation. What happened if you can't reach the diagnosis? Oh, well, this is a big problem, Dr. Nanopan. If you didn't reach a diagnosis, so you are not going to reach the management. You have to practice on cutting the history taking and the data gathering down. You have to practice on that. If you don't do this on your practice, so your practice is aimless. Okay? At first, you will take time in the practice. You will take time in the data gathering. But by the time, while you're practicing every day, you will definitely reach the diagnosis and the management, inshallah, in the 8 minutes. Okay? All right. Let's do the next station. Start, please.
Begin.
Hello, my name is Umama Bali. My GMC number is 8022728. Hello, good evening.
Hello?
My name is Dr. Bali. I'm one of the junior doctors in the GB. Are you Emily Moon?
Yes, doctor.
Can you confirm your age, please?
It's 65.
Thank you. And would you like me to call you?
Emily is fine, doctor.
Okay, Emily, I see that you are here with some concern. How can I help you?
Yes, doctor, I do have a problem in my vision lately.
I'm sorry about that. Can you tell me more, please?
Well, I do have a blurry vision. I don't see everything properly, and it's getting worse, so that's why I came here.
I see. Is it in both eye or one eye?
In both eyes.
I see. And since when have you noticed this?
Well, it started 1 year ago, but it's getting worse and worse nowadays.
I see, I see. And other than that, Emily, have you experienced any pain in your eye?
Pain, no pain, doctor.
Any fever at all?
Fever, no, doctor.
Any discharge from your eye?
No.
And regarding the blurry vision you said it's been over a year and it's getting worse.
Mhm.
When you look at straight line, does it appear wavy?
No,
I see. And do you notice any floaters when you look?
no,
I see. And other than that, have you experienced any headache at all?
no, I don't have headache, doctor.
I see, I see. And I see from my note that you've been diagnosed with a disease called polymyalgia rheumatica. Is that right?
Yes, I do have polymyalgia rheumatica and osteoporosis and hypertension as well.
I see. Do you take medication for all of that?
Yes,
Can you tell me more about this medication?
I take prednisolone for polymyalgia rheumatica, and I take amlodipine for the high blood pressure, and I
I
take alendronic acid for the osteoporosis.
see. And is it all under control?
Yes,
Do you attend your GB follow-up for that?
yes, yes, darling. Yeah,
And are you experiencing any joint pain,
no,
any muscle stiffness?
no.
Have you measured your blood pressure recently?
Yes, doctor.
And do you know the value?
It was within the normal limit. It's 130/90, doctor.
Okay, I see. That's good. And other than that, do you have any allergy?
No,
Any eye disease that runs in the family?
any? No,
I see. And do you smoke?
no, doctor. I don't smoke.
Do you drink alcohol?
Just occasionally.
Okay, and can you tell me about your diet?
What do you want to know about my diet, darling?
Well, do you eat like specific diet, eliminate some of the food, or just eat everything, try to eat healthy, something like that?
Yeah, I try to eat healthy.
Okay, that's good, that's good. And other than that, can you tell me who do you live with?
I'm living with my husband.
And are you able to cope with your day-to-day activity? As you said, you've been having this blurry vision for over a year now.
Yeah, my only concern is reading. I like reading a lot, and I can't read anymore, doctor.
Oh, I'm really sorry about that. We are here to help you regarding this. Just last question. What do you think might be the problem with you?
I don't know.
Oh, and you have not seek any medical attention for it before.
I went to the optometrist, and he told me it's something in my lenses, but I can't remember what
Hmm.
is the cause.
Well, no worries about that at all. Uh, let's find out the problem. I just need to examine you, if that's okay. Take your blood pressure, your temperature, your heart rate, and your oxygen level. I also need to examine your eye.
Mm-hmm.
I'll examine visual acuity, visual field, and papillary reflex and the red reflex. I would like also to examine the back of your eyes with a test we call photoscopy.
Okay, this is the picture in both eyes.
Thank you, Emily, for bearing so far with me. And regarding your condition, I'm suspecting you have something we called cataract. Do you know what that means?
He told me that, yeah, the optometrist told me this name, but I can't remember what is that.
Well, no worries at all. I will explain it fully. It's we have something in our eye called lenses.
Mm-hmm.
These lenses become blurry and cloudy. It affects the vision.
Mm,
Is that clear
okay.
so
2
far?
minutes remaining.
Yes, it is clear. It is clear, yeah.
Okay. Now, it has a lot of risk factor, sometimes due to age, but sometimes other risk factor is some medication. As you have
Mm-hmm.
told me that you are on steroid for your disease,
Mm-hmm.
polymyalgia rheumatica.
Yeah,
So it could be one of the side effects.
yeah.
N-
Okay,
Now, as of what we can do for you is refer you to the eye specialist.
okay.
They may need to do a surgery for you to remove the cloudy lenses and replace it. Do you have any questions so far?
Yeah, so will I be able to read again, doctor, and drive again?
Well, regarding reading, you should be able to read after the surgery. However, regarding driving, we really advise to not drive in the meantime and to inform the DVLA.
Mm-hmm.
And after your surgery, you will probably go under a visual test with the DVLA to be able to drive again. What do you think so far?
Okay, doctor. All right. Is there any complication from the surgery, doctor?
Well, there is some complication, like you may get an infection. It could come back again. However, we also need to refer you to, sorry, we need to adjust the steroid doses you are taking to make sure
Okay,
that it should not happen or you would not have any other side effect of it.
okay.
Um, do you have any other question for me?
No, doctor. No.
Okay. Now, please, if you develop any sudden pain in your eye or in your head or on your tummy also, uh,
Move on to the next station.
Thank you. Time's up. Okay. Thank you, Dr. Umama. So, um, how do you feel about your performance?
uh, a little bit disorganized.
Disorganized. Uh, why do you think that you are not organized? What was the point that you felt that you are not organized in?
Um, I meant it when I get to the prednisolone fact, I should have asked that is the vision worse at night? But I did not ask that. So on when I came back, I wanted to come back again, but I did not want to, to go back again to the main complaint and the differential. So I just did not ask it. When in the end, when I did ask you, have you seek any medical attention, I thought should be at the first, not at the end of data gathering.
Yes, I do agree with you in this point.
And in the management, I should have said earlier about the dosage adjustment before speaking of the surgery.
Why do you want to adjust the dose of prednisolone, darling?
Because he has a side effect like cataract, and he does not have any symptoms. So maybe we can run some tests and see if everything okay. And the inflammatory marker is not so high. We can lower it down.
Well, you will do the investigations first.
Yeah.
Then if it's so you can ask him how for how long is he taking the steroids, because
Yes.
usually the treatment of polymyalgia rheumatica with steroids is 2 to 3 years.
Yeah.
You can tell the patient we are going to do further assessment for your polymyalgia rheumatica. If it's well controlled, we can lower the dose. Okay.
Yeah.
You can say that.
Yeah, you're totally
Okay,
right.
what else?
I don't know. I don't have. Please, can you tell me?
All right, no worries. Okay. So, let's talk about, I can't comment on your body language, to be honest. In your interpersonal skills, from your tone of voice and from your answering of my questions, I couldn't find a major problem in the interpersonal skills. There is one only thing when I asked you about, is there any complication from this surgery?
Yeah.
I think you didn't answer me this question, right?
I just said two complication. I should have explore more. Is that right?
Yes, because this is a concern for the
Yeah.
patient, so you have to address this concern.
Yeah.
Okay?
Of course.
You didn't answer my concern, and then you went to the prednisolone fact. Okay?
Yeah.
This can deduct mark from the interpersonal skills and from the management as well.
Okay.
Okay?
Yeah.
So I would give you 3 in the interpersonal skills based on your tone of voice. In the data gathering, you explored the symptom, all right? Since when? And when I told you it's for 1 year now, you didn't ask me, did you seek any medical advice? What was the diagnosis then? And these things, you asked me these questions in the last part of the history taking,
Yes.
right?
Yes.
Then is it getting worse? What do you see exactly? You told me these. After that, you asked about the differentials. You asked me about the pain. Then you moved on to ask about fever. Why did you ask about fever?
Uh, well, I suspect actually maybe as she's taken polymyalgia rheumatica medication, maybe toxoplasmosis, but because it's a case in the plateau, not because presenting, but yeah, it could be also blurry vision for a long time and immune compromised.
Okay, all right. You can ask this, or you just highlight. Did you eat any raw meat?
I see.
Do you usually work with animals, or do you handle cats?
Yeah,
These are the most relevant questions.
I
Okay.
see. I see.
So I felt fever is not relevant, to be honest, in this case.
I see.
You didn't ask me about glasses, if I
Oh,
wear glasses or not. Any sensitivity to glare as a kind of confirmation if it's cataract or not. These are the things that that I was concerned about while you are taking the history, the present history, and the differential. Okay.
yes.
Then you moved on to the past history. So we have done the present history, then you move to the past history. In the past history, you asked me if I'm having any medical conditions. Then I answered. Then you asked me about the medications and then allergies. Why did you ask me about allergies?
Well, I still did not know your diagnosis, so maybe I will prescribe you some medication in the management.
Well,
Yeah.
okay, I did get your point, but in this case, the examiner might take this question as an irrelevant question. Okay?
Oh,
You can include that in the management. If you are going to give a specific medication to the patient, then you can ask him, do you have any allergy for any medication? This is better. In this particular case, sometimes in some cases, asking about allergy is irrelevant.
I
Okay, like this case. The other thing, you asked me about joint pain, joint stiffness, muscle stiffness, and if I'm going to the blood pressure is controlled or not, I'm happy with the question of the blood pressure, but you can include it in the examination part. You can ask the patient, I would like to check your observations, especially your blood pressure, and I would like to examine your eyes and these things. Okay?
I see.
This is for your time.
Yeah, yeah.
Okay? Why did you ask about joint and muscle stiffness? Just because, just to find out if it's controlled or not?
Ah, yes.
You can ask me, is it controlled or not? And that's it.
They saying that it's not enough. Just ask two or just one or two questions about the symptoms.
Who said that, darling?
I'm not sure, you got a lot of information studying from different people, so that's what I did ask. Sorry.
Okay. No worries. No, I'm just asking who did that, who said that, so I know who is telling you, then I can comment on that. Okay. So asking about if it's controlled or not should be enough in the exam. You have only 8 minutes to do history taking, and then you ask about ideas, concerns, and expectations. You examine, and then you give diagnosis, then you give management. The patient might have some concerns. So all of that should be done within 8 minutes.
Yes.
Okay? They're not going to trick you. They are not going to trick you. If it's controlled, then it's controlled. If it's not controlled, the patient will tell you, oh, well, okay, I'm still having the pain, I'm still having the stiffness.
Oh, I see. I see.
Okay? So just ask one smart question and then move on. This will give you more time for the more important things.
Yes.
Okay? So this is what I wanted to comment on the past history. Then you moved on to the psychosocial part, then ideas. You asked me about ideas,
Oh, yes. I
yeah,
told
and
you.
concern, yeah, and then you examined me.
Yes.
All right. So in the data gathering, there are few irrelevant questions. If you avoid them, you will get higher marks. And some questions that you missed, which are important,
I see.
asking about sensitivity to glare and glasses. Okay,
Yes.
are you do you use any glasses? Do you change the glasses more regular? Okay, this will give you a kind of clue or a kind of thing to help you in your provisional diagnosis if you don't reach the provisional diagnosis from the start.
Yes.
All right, so I would give you in the data gathering too. Why? For the irrelevant questions. In the management skills, you explained to me the cataract. You told me it is treatable. You told me that you are going to refer refer me to the specialist, and they will do a surgery. You answered all of my questions apart from the complication. Okay? If I would ask you the question again, what would your answer be?
Well, first thing is could be an infection. Other thing could be the dislocation of the lenses if any trauma occurs to the eye.
Mhm.
Um, I'm not sure if there's any other complication.
Recurrence.
Oh yeah, I told you recurrence.
You
I told
told
you
me
about
recurrence.
infection and recurrence.
Yeah, okay. All right. So this is how to answer the question. Okay, I would give you. Oh, yeah. Another question, Dr. Obama, you asked me. Diet.
Oh yeah, that was so irrelevant.
Extremely irrelevant.
Yeah.
Extremely irrelevant, okay?
Yeah,
So
yeah,
please avoid that question
yeah.
in the eye cases, all right?
Yes, yeah.
You can ask about diet if you think this is diabetic retinopathy.
Yes, yes.
So it would be relevant in this case, okay? In diabetic retinopathy, not in this case, right?
Yes.
Okay. 3 in the management skills. All right.
Yes.
I will give you a tick in the consultation for the irrelevant questions and tick in the management because you didn't answer one of my concerns. Okay?
Okay.
All right?
Yeah, yeah.
Okay. Do you have
Thank
any question?
What do you think overall?
Overall is okay, but you have to think about the data gathering a bit.
Yes.
Or you have to think about the situation and the symptom to be able to ask the relevant questions. Sometimes asking the irrelevant questions can affect your marks to take 0 in the data gathering.
Mhm.
All right, so be careful in taking the data gathering. Always think about the symptom, the situation, the context to ask the relevant questions.
I see. I see.
All
Thank
right,
you.
okay, so let's do the next one. Dr. Sabrina,
Doctor.
before doing the next one, can I just check the questions?
Sure.
Please, I have a question regarding the management plan on the previous case. Should we not mention something about involving the senior? You don't need, as long as there's nothing for the senior to do, you don't need to mention the senior. Do your job. You are a doctor. Even if you are a junior doctor, you are still a doctor to do your jobs, and then you can discuss it with the senior. All right. As a competent doctor, you don't need to involve the senior. Good. Thank you, Dr. MN. I don't know the name, but thank you. Your answer is very good. Doctor, if we know the diagnosis after a few questions, can we exclude red flags and skip other questions? You can. You can. But exclude the red flags. The most important differentials or the most important questions are the red flags. Okay? There can be recur if there is an honesty. Yeah, it can be reoccur. We are extracting the lens where the cataract will be. What occur in doctor, I don't know the name. If you can just write your name. You asked what occur in intraocular lens. IS is called opacity, not cataract. I didn't get what you mean. If you just write it again, or you can just unmute yourself and talk, please, if you don't mind.
Hello. Hello.
Hello, hi.
Hello, doctor. I'm Dr. Shaima. I'm a candidate with you.
Hello, Dr. Shaima.
Yes, doctor. I'm a ophthalmology resident, and regarding the complication of cataract, it may be infection and recurrence, and also retinal detachment.
Yeah.
But yes, but recurrence is not be able because we are extracting the natural lens and
Okay.
putting IOL. IOL cannot have cataract. It's only opacity.
So the after the surgery, the lens, the intraocular lens can be can
Opacified,
have
but
opacity
yes,
again.
yes, yes, but we cannot say cataract on IOL. It's only on the natural lens.
Okay, thank you for this information. Thank you so much for this information. But
Okay, doctor.
when I'm talking about PLAB 2, or as a kind of exam point of view, um, you are talking to a patient, okay?
Yes, yes.
You don't need to explain this unless, you can say that in the real life, but in the exam, to save your time, you are not having time to explain all of these information to the patient, then you can say recurrence.
Okay, so
Got
we
it?
just can say retinal detachment, infection, and other complications. So I don't know, the examiner may be knowing this information, so I don't know.
No, it is not an information that will affect you at all.
Okay, it's okay.
Okay, I'm sure of this. I'm sure of this
Okay,
information. Don't worry. Okay.
doctor. Okay, thank you.
From my experience of this exam, this is not a problem that will affect you at all. This exam is assessing your ability to deal with the patient and also your knowledge. Okay.
Okay,
If you didn't give a wrong information to the patient, you didn't give a wrong information to the patient, it can reoccur again. What is the process of this is not the major problem now in this case. Okay.
yes, yes,
Got me?
okay,
Yeah.
yes.
Thank you.
Thank you.
Thank you for this information. I'm happy that you gave me this information, but I wanted to explain to you what they assist exactly. All right.
Okay, doctor, thank you.
Thank you. Thank you so much. Okay, let's do the next one.
Begin.
Hello, my name is Dr. Sabrina Merchant, and my GMC number is 8031283. Hello.
Hello.
Hello, my name is Dr. Sabrina Merchant, and I'm one of the junior doctors at the GP today. Can I just confirm, am I speaking with Emily Moon?
Yes, doctor.
All right, nice to meet you, Emily.
Mhm.
Can you just confirm your age for me, just for this meeting?
Yeah, it's 30.
Okay. All right. So, Emily, I can see from my notes that you've come with some concerns regarding your eyes. Please tell me what seems to be the problem.
Yeah, doctor. I have some burning sensation and itching in my eyes.
Okay. I'm really sorry to hear. It must be really discomforting for you.
Yeah.
I'll ask you a few more questions just to gauge what the problem is and
Okay.
take it from there. Okay.
Yeah.
Right. So tell me, you said that you've been having some burning sensation in your eyes. How long has this been happening for?
4 days now, doctor.
Okay. And other than this burning sensation, is there anything else that's happening?
But burning and itching and some discharge as well.
Okay, all right. So you said that it's burning. Is it burning inside, or is it burning also outside as well?
Burning inside.
Right. And does it make you itch your eyes?
Yes.
Okay. And can you tell me if there's been any swelling around the eyes?
No.
Okay. And just to make sure, is it both your eyes involved? Okay, all right. And you mentioned that there's some discharge as well. What kind of discharge is it?
Clear discharge.
Okay, all right. And by any chance, have you noticed any like bleeding in this discharge
No, no, no,
and never any pus?
no, no, no,
Right, okay. And when you said that it itches as well, other than the eyes, does it itch around the eyes or anywhere in the face?
no,
All right. And does it hurt on moving your eyes like back and forth?
no, it's just itching, no pain.
Have you noticed any swelling around the eyes underneath or on top?
No.
Okay, all right, okay. I just wanted to ask, have you had any fevers related to this?
Fever related? No, I don't have fever. No,
Fever? Okay, any sort of headache?
no,
Okay, and just also, if you could tell me if there's any pain around the eyes or within the eye?
no.
All right. Thank you so much. All right. So can you just tell me, have you had any recent like have you gotten any eyes procedures done recently?
No, doctor.
All right. By any chance, do you wear any glasses or contact lenses?
I wear contact lenses, yeah, but I can't wear it
All
since
right.
days now, yeah.
And before this, have you ever had this sort of situation before ever?
Yeah, it comes and goes, this itching and burning, yeah.
Would you say that it's associated with any seasonal changes?
I would say that.
Okay. Would you say that it happens every time a specific season comes or just whenever?
I'm not sure about this. I didn't,
Okay.
think about that, yeah.
All right. So just to ask you a little bit more, do you have any allergies with anything?
I do have allergic rhinitis.
Okay. All right. And are you taking any medications for that?
No, just,
Hmm?
no,
No sprays, nasal sprays, anything like this?
no, no,
Okay. All right. So just wanted to ask you a little bit, have you been diagnosed with any medical conditions before?
no,
Okay. And are you on any medications at the moment?
no,
Okay, all right. Have you noticed any sort of eye problems in the family? Has anyone had any eye problems in the family?
not that I'm aware of.
Right. And you mentioned that you're wearing contact lenses. Is it for just the color of the contact lenses or is it
No, no,
for?
no, no, for my
Mhm.
sight,
Okay, all right. Could you mention, do you have a farsightedness or nearsightedness?
farsightedness.
Okay. All right. Thank you so much for answering all my questions. I'd just like to ask you at this point, do you have any ideas or any thoughts about what could be the problem regarding your problem at the eye right now?
No, doctor.
Mhm. And do you have any specific concerns you want me to, address?
Yeah, will I be able to wear the lenses again, doctor?
Okay, all right. That's something that is a very valid point, and I will get to that just a little bit in a few minutes. All right.
Okay. Yeah,
And have any expectations from me? Any specific expectations?
nothing specific now.
Oh, all right. Okay. Thank you so much. All right. I'm just gonna quickly have a look in your eye, and also just before that, check your blood pressure, your vitals. That includes your respiratory rate, oxygen levels, just to see if everything's all right with you. Other than that, I'm just gonna have a look at your eye. I'm gonna also have you do a visual acuity test, which basically just sees if the functionality of the eye and if you're able to see everything normally. I'd also have a look at around the eyes just to see everything's all right. Is that okay?
Yes.
All right. Okay. Okay. All right.
Vitals are normal.
All right. Okay. Thank you so much, Emily, for answering all my questions and letting me examine you as well. So from the discussion that we've had, it seems to me that what you're going through at the moment is something known as allergic conjunctivitis. Have you
Mm.
heard of
I know allergy, but what is this conjunctivitis?
It's so you're right on the dot about that. It's related to allergies, and
Remaining.
what it means is that there's allergies regarding the eye. Okay, so conjunctiva is basically a lining of the eyes, and allergic conjunctivitis means because of some allergies that you're experiencing, it's causing inflammation of the eye.
Okay. All
Okay,
right.
do you have any
Okay.
questions about this?
No, no.
So there are some things that we can do about this to help you out, and specifically about your concern regarding the whether you can wear your contact lenses or not. At the moment, you won't be able to wear it just because of the inflammation on the eye, but we will be helping out. There are some measures you can take as well as some medications we can give you, and this time, once it subsides, you will be able to wear the contact lenses. All right.
All right. Okay.
Because it seems to me that the allergy that you're having is regarding seasonal changes and not specifically because of the lens that you wear. All right.
Okay.
So there are some things that we can talk about. What would you like to know more about first? Would you like to get into the medications or just the measures you can take first?
Whatever you want.
All right. Okay. So, you can take some measures in your life, daily life. I would really appreciate if you could avoid scratching your eyes or itching your, sort of rubbing your eyes. It can cause a lot of irritation to the front layer of your eye, and it can cause some irritation. So, let's avoid that. I would also suggest if you could avoid wearing any lenses for the time being, just so that we can make sure everything's all right. I'd also sure that whenever you go outside and then you come back at home, just make sure that you just rinse your eyes and also have a shower. Maybe there's some allergens stuck in your hair, anything like this, so you can just take a shower and it should be fine. All right.
Okay.
That you can also there's also some medications we can give you, so just some artificial tears that we can give you just to
On
lubricate.
to the next station.
Time's up. All right. Thank you. Thank you. So, how do you feel, Dr. Sabrina?
I feel okay. I was trying to communicate with you and trying to be good with my body language, but maybe the management could be more better.
Why do you think
Like
the
I
management should be?
mentioned something like, we can give you some topical drops, eye drops to manage your allergies, something like this. I don't know.
You mentioned it. You
Okay.
mentioned it at the end. So
Yeah.
as long as you've mentioned it, it's okay. Okay. All right. Do you think that you missed any specific thing in the data gathering?
I could ask, like I could have asked smoking. I guess maybe that could be asked.
But yes, you could ask about smoking because it's a risk factor of worsening of conjunctivitis. What else?
maybe some sort of food particles that can cause some sort of like some sort of allergies. If they're allergic to any specific foods or any pets or anything like that, maybe I can ask.
You didn't ask about allergies? You didn't.
I didn't ask. I was focusing on seasonal allergies. I didn't focus on like other things that can cause like
Okay. Yeah,
dust
no worries.
or something.
Okay. Anything else that you think?
Begin.
I can't think of anything else.
All right. Okay. All right. So can you see the slide? Okay. So, and let's talk about your body language first. I can't comment on it. Okay. It's, no major problem.
Okay. I thought it was so bad. I can't comment. It's so bad.
I don't have a comment on it. Okay. So yeah, you have a very good eye contact and a proper body language. So no comments on your body language. Well done. Okay. This is in terms of your body language. In terms of the interpersonal skills, also no comments on them. I couldn't find any major problem in the interpersonal skills. You could have asked about the psychosocial part. I mean, how have you been affected? Because it's recurrent, so is it affecting you at all? Affecting your job, affecting, your daily life activity? You can ask this question. This is the only thing that I could add, or I could say. Yeah, so I would say, to be honest, you can take 4. In terms of the data gathering, you could have asked about vision affection. Okay. Any eye symptom, please don't forget vision. It's important, okay? A problem in the eye, always make sure that the vision is not affected, okay? What else? You could have asked about smoking, okay? And the psychosocial part. These are the 3 things that I would say in the data gathering. And because the vision is not affected,
Yeah.
so 3 in the data gathering, okay? In the management skills, you explained the provisional diagnosis very well. You reassured me. You addressed my concern. You gave me some advice to do. You gave me treatment for that. So well done. Very well done.
Thank you.
Okay. So, yeah, no major problem as well. Okay. I would give you a small tick in listening because you asked me one of the questions twice.
Okay.
2 questions twice. Swelling around my eye, itching, and also pain.
Okay. I was trying to rule out like orbital cellulitis or peri-orbital, you know.
Yes, this is yes, I got it. I got what you meant, and I was happy by asking it. But you asked these questions twice, not once. Okay, you asked them twice. You asked me first, any swelling, any itching, then you asked me some questions, and then you
Came back to it.
came
Yeah.
back again by asking these questions. Okay, so just a small tick in the listening. Apart from this, well done.
Okay. Thank you.
Okay, no comment. Even I can't, nothing to add if I would like to comment in the management, or you can just say we can consider antibiotic if the if you have any symptom of worsening or discharge, color discharge, and these things. Okay,
Follow up. We can follow them up if they have any problems, and we can give
yeah,
anti.
and leaflets.
Yes. So, okay.
All right, well done. Okay, so we have done the 4 cases for today. Any question, doctors? Okay, so everything is clear. Thank you. Thank you, thank you, thank you. Just want to thank you for your, thank you. Thank you so much. Okay. If you are watching the mock on the YouTube, you will find the links of the groups in the video description. You can join us, and you can subscribe in the YouTube channel if you would like to have all the new videos. Dr. Sabrina, thank you. So kind of you. The next mock will be on. Thank you, darling. You've done really well. Hopefully, we hear very very good news about your exam, inshallah, and your results, inshallah, darling. Okay. The next mock. Just a second. I'm answering the question. So the next mock is in the next Saturday. All the mocks and all the free sessions are on Saturdays 11 a.m. Saturdays 11 a.m. I'm thinking about making the next session is mock instead of doing teaching, because some of you send me a message about that. If you just make some mocks for us, because our exams are approaching. So I'm thinking about making, the next, in this month, all the sessions will be mocks instead of teaching in mocks for this month, and then we can resume again. This is for the free sessions in mocks.